Good afternoon, everyone, and I want to welcome everybody to this IAFC webinar. This is our 11th webinar dealing with the coronavirus. We've had some other webinars specifically just for the Economic Task Force and other information, but this one is strictly with the coronavirus task force that we've been doing. And so this is our 11th one, and again, I want to welcome everyone. My name is Gary Ludwig. I'm honored to serve as the president and chairman of the board for the International Association of Fire Chiefs. Just as a reminder, we conduct these webinars every Monday at 4 p.m. Eastern Standard Time. You're welcome anytime to join us. All you have to do is register on our website at iafc.org. I want to thank you all again for joining us on this webinar, either directly or later when you might be listening to a recording of this. The IAFC represents the leadership of over 1.2 million firefighters and approximately 30,000 fire departments in the United States. We have members in Canada and other countries around the world. Our coronavirus task force is chaired by Chief John Sinclair, and our economic task force is chaired by Chief Steve Pegram. You will hear from Dr. Jim Augustine today. He will give you the latest information as it pertains to the coronavirus. Again, Jim's information is always timely, very accurate, and much needed because this changes, as I've always said, not only on a daily basis, but almost weekly with the data, the information that's coming out. Also on today's show is our Government Affairs Director, Ken LaSala, who will provide us on a legislative update. And our special guest today is Captain Frank Leto, Director of the Counseling Unit for FDNY. Frank has over 37 years, and actually today is his anniversary date with FDNY. Today is his 37th year serving with FDNY, and Frank has over 20 years with their Crisis Counseling Unit. He will share information today that certainly will give you information as it deals, how to deal with the stress of the COVID-19 pandemic that has been put on so many of our firefighters. Frank will be able to share great, valuable information when it comes to behavioral health. But before I begin, I want to update everyone on the latest number of deaths in our profession as it relates to COVID-19. As of last Friday, that number was 54. That's not a good number. And unfortunately, we like to hear the number of 0, but that's not the case. And our thoughts and prayers certainly go out to those families of our brothers and sisters who have lost in this battle. That information that we get, I want to give credit where credit is due, and that comes from Ron Sarnicki. He's the Executive Director over at the National Fallen Firefighters Foundation. So we thank Ron and all the staff over there who keep all this information and do what they all do for fallen firefighters. I wouldn't be able to go on with this program today if I didn't talk a little bit about what's going on in our country. I want to talk a little bit about the civil unrest that is occurring in many of our cities, including my own here in Champaign, Illinois. We had 27 people that were arrested here last night in my city, range from anywhere from looting to rioting and other types of charges. And I've seen countless attacks across our nation over this past weekend against firefighters. Either there's been in the form of hitting them with rocks, stones, bricks, fireworks, damaging fire apparatus, damaging fire stations. And in one of the most despicable things that truly angered me, a firefighter memorial in Rochester, New York, was defaced. And that was to deface the memorial of firefighters who have given up their future for their communities is truly despicable. So I can't sit by idly. We need to do something about this. And one of the things that I have done is issue a statement today that has just gone out within the last hour to the general public, not only to the fire service, but to the general public, that we are not the enemy. There is no reason to attack us. We are only here to help. That, as I said, that email blast came out along with links to other resources. If you're an IAFC member, you should have received that in your email blast by now. It's also going to be on our landing page and on our website. And as I said, that's going out to the media. And so we, again, hope that we have some impact there, because the safety of our firefighters is paramount and is a priority. And on the screen there, you'll see my statement from the International Association of Fire Chiefs. So anyway, again, I pray everyone remains safe and everyone stays good. On your screen, you will see a list of resources available on the IFC website when it comes to mass gatherings. We issued a statement last week from our Terrorism and Homeland Security, not a statement, but a resource guide to those of you who are trying to deal with mass gatherings during this pandemic. Again, the safety of our firefighters is paramount and is a priority. And again, those resources, again, are in an email blast, or you can find them on our IAFC website. If I could have the next slide, please. So I already introduced our panelists today, and so if I could have the next slide, we might get started and talk about launching to our special guests, not our special guests, but our guests who are today ready to speak. So I don't know if John's joining us or not. I think he had some issues going on out there. John, are you on with us? All right. Well, maybe John will join us later in the show as we go forward. So I'm going to allow. I think Ken LaSala, you're up on deck. You're in our staging area. So Ken, you want to talk a little bit about what's going on at the legislative level when it comes to COVID-19?
Sure. This will be pretty quick. I just wanted to update everyone on a couple of things. Right, the big thing, moving on to the next slide here, is just first you'll see, the IFC continues to work on passing the HEROES Act. It obviously passed the House, so now we're trying to educate the Senate on the importance of some of the public safety provisions to the HEROES Act. Specifically the $500 million for the AFG program, the $500 million for the SAFER grant program, the need to waive requirements like the cost share for both programs, and to use the SAFER grant program to rehire and retain firefighters. Moving on to the next slide, just some other provisions we're talking about. Specifically, as you can see, there's some tax benefits, including or especially for volunteer firefighters in the HEROES Act. And then also, we're trying to get Congress to repeal the statutory requirement that the FCC auction a T-band. Obviously the T-band is the major interoperability channel in 11 major metro areas. So it's being used not only for COVID response now, but also for civil unrest response. So we really need Congress to tell the FCC not to auction the T-band in February. So that's the big stuff. We continue to run our grassroots campaign. We urge you all to take action. And moving on, I want to talk for a minute or two about some PSLV legislation. I think I mentioned last week that 2 weeks ago, the Senate had passed S3607, which was a bill by Senator Grassley to, and of course had bipartisan support, like Senator Booker was a supporter of it. But basically what it did was it was a Senate bill clarifying that the families of public safety officers who died from exposure to COVID-19 or became disabled from it would be eligible for the PSLV program. That was 2 weeks ago, was the Senate bill passed. Last week, the House bill passed, that's HR 6509. And that's by Chairman Nadler, the chair of the House Judiciary Committee. And then other folks are supportive of it, like Congressman Peter King and Congressman Bill Pascrell Jr. So this bill that passed the House last week, it's a little bit different than the Senate bill. You can see some of the differences. First being that the time of the presumption has been expanded. Basically, this bill would go from January 2020 to January 2022. Some parts are the same, like in both cases, the officer would have to have been diagnosed with COVID-19 or display evidence of disease within 45 days of the last time on duty. The House bill actually has an interesting provision for 9/11 World Trade Center cases. Basically, if a firefighter served on Ground Zero and came down with some type of lung ailment that resulted from their service at Ground Zero, and then caught COVID-19 and became permanently disabled or deceased, then the family would actually receive PSLV benefits under this Nadler bill, and that's not over in the Senate bill. So the bill passed the House last week, and now we're hoping that the House and Senate will work together to reconcile the differences, and hopefully we'll see this PSLV legislation pass fairly soon. Moving on to the next thing that passed the House last week. For those of you following the Paycheck Protection Program, the House also passed a bill to make some changes to that. And that's especially going to be helpful, we think, for volunteer departments because 501c3 fire departments or self-incorporated fire departments that are 501c3s can apply for the Paycheck Protection Program. This made a couple of changes. It extended the covered period from June 30th to December 31st. The bill would allow beneficiaries to spend funds for over 24 weeks or until the end of the year. And you can see some of the requirements there. Beneficiaries would have 5 years to repay the funds owed on the loan. And then this might, again, help some fire departments because the bill would reduce the requirement to 75% of the funds be used from payroll. It would reduce it from that 75 number down to the 60% number. This legislation has passed the House last week, and now it's over in the Senate. We hope that the Senate will pass this legislation this week. I know that there's been some discussion about making some changes to the bill over on the Senate side, so we'll just have to see kind of how it all plays out. But again, it's another bill which we're hoping to see pass, hopefully within the next week or so. So that's my report, and I'll turn it back to you, Chief Ludwig.
Thank you, Ken, and I appreciate everything that you and your staff do, including Evan Davis and Brandon Allen in our government affairs area. The advocacy up on the Capitol Hill that you all do for us is phenomenal. There's no other way to describe it in the work that you all do, so thank you. I just want to make one quick comment. I've had people contact me, and they're outraged that we would support a $3 trillion bill that has many things in it outside the fire service. It deals with illegal immigration, voting by proxy, a bunch of things like that. And I tell people, my goal is not to deal with those issues. Our goal is to represent our members and the association, the fire service, and we're only worried about the provisions that are inside that bill that impact the fire service. And if we were to put a wish list together, Ken, I'm sure you can validate this, that there are many wonderful things inside that bill for the fire service. And that's what our government is all about. Is it goes to the Senate. They will either mark it up and modify it, or they'll come up with their own version. They'll go to conference committee and work it all out. That's what America's all about. And we don't care what that final bill looks like as long as all those great things that are currently in there are still in there for the fire service. So, again, I just want to address that on some of the things I've heard from some people that have been upset that we're supporting the HEROES Act. And, my question back to them is, what do you want us to say? No, we don't want all this stuff for the fire service. You want us to give it back? No, there are a lot of wonderful things in there, and we want to try to support those provisions in that HEROES Act for the fire service. So, but thank you, Ken, again, for all that information. Next, I'm going to turn it over to Dr. Jim Augustine. And Jim, again, you're a jewel to our coronavirus task force. I can't thank you enough for everything that you do and all the information you have that is so timely and relevant. So, Jim, I'm going to turn it over to you and allow you to do your thing. You now have the floor.
Chief Ludwig, thank you very much. We are very blessed to have you as our leader right now through a lot of challenges to all of the chiefs who are out there. So I'll keep it quick because the next presentation about behavioral health support is really important. What is new in the medical side of the coronavirus? What you are watching, I'm sure, is your local EMS volume, which is going up, which is seasonal for us. I was on a call this morning where people talked about their EMS volumes being down 20 to 30%, and they're now back up to within 5 to 10% of their year ago volume status. That's good. The state and local tracking systems for coronavirus are improving. We're finding the points now where there's conflicts and inconsistencies and working to improve them. Chiefs, very important that what you really watch is the number of people hospitalized, the number of deaths, and the number of patients on ventilators. Right now, most of the outbreaks are occurring in congregate settings, which are oftentimes nursing and senior facilities, but still prisons and settings like where they process meat, poultry, fruit, etc., are still very important. In a number of places around the country, the fire service is part of local strike teams, a really important role and a really important function for our trained fire EMS people who are valuable as members of the strike team because they're in and out of those congregate facilities anyway. And then we're aligning this with what's going on for our usual tornado and hurricane times. Next slide. Volumes, I just wanted to reflect for those of you, we just finished our May volumes yesterday, so I don't have them yet. But in the state of Georgia, where I practice, we compared our April 19 to April 2020 volumes. Our calls were down 13%, our transports down 18%, our motor vehicle crashes down 55%, out-of-hospital cardiac arrests up 25%, and dead on arrival cases up 50%. In some ways, again, reflecting the concern we have about sending people into harm's way in cardiac arrest situations where there's really no hope at resuscitation. Nationwide, I want you to know volumes in March and April are down 48% in emergency departments. So we've seen significant volume reductions in EMS and the emergency departments. Next slide. Your staff is still very important, and our ability to protect their health is very important. Your ability to monitor them, and we've given you this nice form to use over a 14-day course where from exposure until we clear them. This is a way of moving through a time when in the past they might have been on quarantine, and instead we're doing daily symptom checks, and if they're on shift, a temperature once or twice a day. We are trying to think through the implication of mask use and when it needs to be done in the stations and when that could be relieved a little bit. There's going to be no single indicator that tells us what the right time is to release the crews back to their normal way of interacting in the stations, particularly in the areas of the station, kitchen, bathroom, day rooms, where they're in close proximity with each other. We also are short on gowns and have been short on gowns, and probably, especially in the summer months, need to restrict those to when we're doing aerosol generating procedures, intubations, patients with diarrhea and other body fluids, or that are coughing, sneezing uncontrollably, and we need to protect our clothing. So those are important parts in protecting staff that continue to be relevant. Next slide. PCR testing, a lot of work going on now in the testing arena and about what positive tests mean and what negative tests mean and how long-term we will or will not be using testing. So a reminder for all of you that PCR testing is about swabbing or spitting, and the testing process is one that looks directly for the virus or evidence of the virus. It can be done quickly, and so a number of places are implementing these. As you know, the FDA last week took down a large number of these tests that were not scientifically proven and may give very dangerous levels of false negatives. Next slide. The next part of testing is the look for antibodies in the blood system. These will involve two types of tests, one for each of the particular types of immunoglobulins, one that is released early in the course of the disease, one that in many other diseases means there's long-term protection against this organism. So you'll hear about blood testing, and that blood testing or serologic testing or antibody testing, all those are the same names being used for this process of testing for a body's response to exposure. We don't have all the answers yet. You've heard this called the Wild West of testing right now, but the FDA and the medical literature is coming up to speed, And I think in the next month, and at least by the end of July and into August, we will have good answers about where this fits in our public safety arena, telling us who has been exposed, who potentially is safe, or who is a candidate for the vaccine when it comes available. Next slide. Into the fall, we have issues that the fire service will need to address. The issues are likely to include recurrence of the coronavirus in association with the other seasonal viruses and bacterial illnesses that we address every year and have crowded hospitals, crowded clinics, and crowded EMS services. In the next few months, it is likely that we will pull together larger and larger groups around the issue of public messaging. And we will be working with public health, medical systems, the hospitals, family medicine, you name it, bringing together a consistent message. That message is what you are to look for if you're a member of the public, when you're to stay home, when you're to go get tested and where you will get tested, where you will go to get treatment if it is needed, what will likely get you admitted to the hospital, and then how are we going to track all that, both at the big health system level and then locally, and even within your department, for those of you who do very good looks at your local data and decide locally on your hot spots. Those will be very important. The fire EMS service as the point, the touch point for many of these illnesses will need to be very involved in that. And we will also likely be involved in testing and in vaccination programs. And in developing messaging programs, I look for us to develop that for our members. So for the members of the fire EMS and police forces, what to do to keep them safe through these different outbreaks, and what will keep them and their family members safe so that they can serve and message the general public. Next slide. This fall, and I was just on a conference call at 3 o'clock, and they're talking about PPE being released and them having enough PPE that it could now be moved out into dental offices and veterinary offices, many of whom contributed at the beginning of this, their PPE, so that the health system and public safety could be supplied. And now as they would like to reopen their offices, we're beginning to get to the place where American supplies of PPE are beginning to move back through the system. That was the best news that I've had, in the last 5 days as things have been going. Anyway, more PPE should be available by the fall. We will know more about how testing fits into our practice of keeping people safe, including our crews. And then the next decision making that will go on locally is how the hospitals will be used this fall. And if there will be hot and cold designations for hospitals, that will be a very important decision for all of you to be involved in. Next slide. So a second shutdown is possible with, again, dramatic implications for your local economies. We are looking at a time when there will be a busier system, which is our usual busy time of the year, both for illness and then, frankly, for fires to begin kicking up again as cold weather gets here. The testing and the vaccination programs will be areas that we need to be involved as a service. So thank you for what you do. Chief Ludwig, thanks for the opportunity to present again this week. And I'm very interested to hear our next presentation about behavioral health support for our members. Thank you very much.
And thank you, Jim. Again, just outstanding information, wonderful, phenomenal. I'm trying to think of all the words that apply, but again, we are so thankful that you are part of our team and giving us the information that you do. And thank you for, again, just being a part of us. And I can't thank you enough because I know you're pulled in so many different directions. So thank you again. And I'm with you. I'm anxious to hear our next speaker also, and that's Captain Frank Leto. Again, I early on, if you're joining us late, I talked about him. Today is his 37th anniversary at FDNY, and he's 20 years with the crisis counseling unit with FDNY. And we're going to talk about behavioral health and resiliency and a bunch of other issues today. for our firefighters who are dealing with so much stresses out there right now. So with that said, Frank, you want to give us a little background about yourself?
Sure, Chief Ludwig. First, I want to thank you, thank the IFC for having me on. It's an important topic, behavioral health, and our members around the country are dealing with unbelievable stress when it comes to the COVID crisis and now the civil unrest. And also our thoughts and prayers with our brothers and sisters that are dealing with the civil unrest and the COVID crisis. Again, my name is Frank Leto, and I've been the Deputy Director of the Counseling Service Unit since before 9/11. So my work, and I work closely with the National Fallen Firefighters Association and the International Association of Firefighters, and had been behavioral health coordinator for a number of crises around the country, earthquakes in Haiti as well, and airplane crashes. But I've never, in my wildest dream, would have expected what we're going through in New York and around the country when it comes to the stress that our members are under when it comes to this COVID crisis. So if you can just move to the next slide. I just want to give a little bit of the demographics of the FDNY. So we have 17,000 employees in the FDNY and 10,000 are firefighters and 4,000 are EMTs and paramedics and 2,000 civilians. And we also have about 300 fire locations. So when we have to reach out to members of the department, it's quite a task to do that. But when you look at the FDNY, most people see this mammoth, but it's really a bunch of small departments. Each battalion is, a community within itself. So it's not what people think in many terms as far as this big mammoth. You can move to the next slide. And so when the crisis was first, starting, one of the things that we did right away, and I tell you, the chief of operations and the chief of the department, John Sudnick and Tom Richardson, had done an unbelievable job in getting us prepared for the crisis. They did right away. We changed our work schedules, which was really important because the way our schedule works is that we work with many different people, and they said, no, this is important that because the virus was spreading so rapidly, that we went to an ABCD chart, which is common around the country, but not in New York. They also restricted the details where members would only work within their own houses. And then as the crisis really started to ramp up, the CPR protocols were changed. So this is, I won't get into the details about this, but the amount of stress on the members with the constant daily changes in the protocols and in their work schedules, and then what else was going on in their home, and then sickness on top of it, really brought stress into the department and into each individual member. You can go to the next slide. So a 1037 Code 1 in New York is a cardiac arrest. And at the height of the crisis, our department responded to almost 3,200 in a 3-week period. You think about that. On April 6th, we had 305 cardiac calls in one day. That's 10 or 12 going on each hour. Our members were experiencing death and CPR calls in a 3-week period that someone doesn't experience in a 25 or 30-year career. It became overwhelming and exhausting, emotionally overwhelming and exhausting. The members kept working, but it started to wear them down. You can go to the next slide. So one thing I think is real important, and I'll get to it a little later on, is information. And information is tremendously healing when you're in the middle of a disaster. I know as a responder on 9/11 that people that were at home watching CNN knew more than me. They knew more that was going on than I did. I mean, I was working in one void or in one area of the trade center where my wife and kids were home and watching the news and knew everything. So with not having information is very stressful on a first responder or a firefighter. I remember we had a plane crash in Rockaway in the same year, 2001, November 11th in 2001. And we thought for sure, again, it was another terrorist attack. But the chief of operations at the time, Chief Saltasana, who eventually became the chief of department and then commissioner, gave information right away to the members on the scene, saying this is not a terrorist attack. And as soon as information became available, he tried to disseminate that to the people on the scene. And again, that in a crisis, information can be very healing. If what you're looking at here is something that came out from our IMT team every day, and you probably can't read it, but it gave information. It was usually 3 or 4 pages long. It would tell you the people on the top, the people that returned from service from being sick with COVID. So that on this is telling us about 1,870 people that had been returned by August 12th. And we still had 2,000 of our members out sick. So, right there is 4,000 of our members that were either had the virus at that time or had returned from it. So that's the impact that it had on our department. And then information that was, below that in the yellow, if you could see it there, first of all, we would talk about, the people that had died within that day. We had 11 members of the department that died, civilian and EMTs as well. So, and then after that would be other protocol changes and just basic information to the department that everyone had access to. So I think this was one of the main things that we learned after 9/11 is to give that information, and a chief officer could really make an impact there on the emotional health of the department. You can go to the next slide. So, what did we see? And I'm going to spend a bit of time on this slide, because it kind of came in waves, what had happened. And the first wave was just the basic anxiety of getting sick. And, being that we were going to so many calls where people were dying at their home, and those people, I don't even know, if they were being counted in the numbers of the dead from COVID. But so now we're seeing that we don't have a lot of the equipment that we need and our PPEs. We're reusing them, and just the general anxiety that everyone felt of being sick. And so there were some houses and some EMS stations that were affected terribly with the illness. And, we had members on ventilators and really sick in hospitals and at home. And then every day we had to go back to work. And that started to wear people down. But what I think wore people down more than anything was the anxiety of infecting others. And, that's something, we protect our families from information. We protect our families from what we deal with on an everyday. Now we were going home and infecting them. And that really bore, that was a main issue. People were calling up and said, I have a child with cystic fibrosis. I have a wife that's going under cancer treatments. I cannot go to work and bring this home to her or him. So, one of the things that the department did, and again, we're trying to lower the anxiety. Our focus is to have the healthiest, mentally healthiest workforce we can. So what can we do in this area? So one of the things that was done right away was making sure we had enough hotel rooms that were free of charge for members to stay while they were full duty and working in firehouses and EMS stations. Now, it's not ideal, but if you have this anxiety and you have somebody that's at high risk at home, that's what you would want to do. So we had hotel rooms available throughout the city where members can go. We also gave them lots of information on how to protect their family to lower that anxiety. The next thing that we saw was, and this started right away, people that were quarantined and were sick were presenting with many behavioral health issues, mental health issues, depression, and other issues. I mean, we had them in quarantine or at a hotel, and they were calling tremendously anxious, not able to sleep, and a number of other issues that were popping up. And again, I'll address what we did with that. And then, of course, the traumatic effects of the responses. That was really impacting our members, particularly in EMS and some CFR, some of the busier engine companies that were responding on these CPR calls. Changing the CPR protocol where the members are able to pronounce a death. One of the other things that we did, all these have been changed back to the normal procedures, but one of the other things that we did was we would leave the person that had passed away at home to be picked up by someone else, so that was, we always would respond, do CPR, bring the member to the hospital, and now we had hundreds of bodies around the city that were just left at home to be picked up. Another issue that we saw was just general isolation. People that were, we have taught people to how to take care of themselves. And one of the things to do to take care of yourself is to be with family and friends. And what this crisis did was we were telling people, you can't be with family and friends. So isolation started to affect people. The things that people did and do to take care of themselves, they were no longer able to do. They weren't able to be with family and friends. They weren't able to go out for a cup of coffee, go to the gym. All the things that they've been taught over the years helps and works. That was not allowed. So again, we had increasing anxiety. Child and elder care was a major issue that we ran into, and again, something that I did not expect to see. Now you have many families and many firefighters are married to other people in the health profession. I'm married to a nurse, so she was called into action. I was called into action, and who's going to take care of the kids? The kids are home from school. Elder care issues, and now many firefighters around the country are taking care of their elderly parents. Now they, as first responders, where they're at high risk, were not able to take care of their parents, and the anxiety that brought on, was really tremendous. And all this is like a domino effect. All these stresses are impacting people, multiple of these stresses. Another thing that I did not expect to see in my lifetime or in my career is the amount of grief. Hundreds, and I don't have a number, but hundreds of our members lost a loved one, and some multiple. And some of those members brought the virus home when they lost a father or a mother or a grandparent. We had a member, lose a spouse, and we had a member lose a 4-month-old baby. So the amount of grief that was going on in our department, and then the not being able to, say goodbye in a proper way when the member was in the hospital. We had 2 of our members where the hospitals actually lost the body of their loved ones, so they couldn't, have a service because the bodies were missing. They had been misplaced because of the, as you drove around New York City, there were refrigerator trucks in front of funeral homes and hospitals, and in front of hospitals I drive past Bellevue every day. There were 3 refrigerator trucks just outside, and so the chaos that ensued from that. And then the financial stress, when my dad was a firefighter, when he was a firefighter, his salary was able to support our family and nicely. But now most families depend on the dual income, and they're kind of just treading water. And so one of our spouse or one of our children loses their income, and that really starts to bring financial stress. So not only do you have this major impact of what's going on, now you're not able to pay the bills. And you know, something that you don't see a lot of in the fire service of domestic violence with our members. I saw it after 9/11. I saw it again here. Domestic violence increases with our members, and it's important to have a good education around domestic violence and resources available for our members. We saw exacerbation of pre-existing conditions. So, and you know, if you were treading water with a substance use disorder before the COVID crisis, this kind of brought you over the edge. So we saw that, we saw our members were having difficulties, and we kind of had an uptick of people that were wanting resources for drinking too much or drugging too much. And, so that was another thing that we saw really early on in this. And then other issues, research shows that about 8% of the workforce of firefighters around the country can be diagnosed with clinical depression. That's a high number. It's 8 in 100. That increased with COVID. After the 15-year anniversary of 9/11, they had a data on FDNY, and FDNY is right where the country what you would expect to see in depression. About 8% of our members are depressed. What was really surprising to me is, if you look at that research, is that about 22% of our retirees are clinically depressed. I mean, that's almost a quarter of our retirees are depressed. So that are no longer responding to crisis. They should be home golfing or playing with their grandkids, and now we have a quarter of them depressed. So that's probably not a discussion for today, but that's a discussion that we need to have. If a quarter of our members at any given time are clinically depressed when they leave this occupation, we need to be doing a better job of taking care of them. And when they retire, that should be the start of reaching out to them. So and particularly today, with many of our old timers that are isolated and have lung issues, reach out to them. Give them a call and check in on them. Because number one, even before COVID, there's a good chance that they may be having some difficult time, particularly early on in their retirement. So, please do that. The other thing we saw, anxiety disorders, we were getting calls of people that just couldn't sleep, had this terrible feeling in their stomach. They were anxious like I'd never seen to go to work, I've been in New York for a long time and been through many difficult times in this city, but never did I get calls, and our unit get calls saying, I just don't want to go to work. I'm just a bundle of nerves. It was just building and building and building. And, PTSD is, something that affects our members throughout the country. It's, not a high percentage of our members, but it's, 5-10%, whatever it is, that's enough. And when that's a percentage of the workforce. And when you put this kind of stress on someone that has this diagnosis, that person, now you're looking at somebody that can really be going down the tubes. And now, with all of this, you have to think about, suicide and suicide prevention. You have these major stresses on our members, and now, and with no relief in sight, and their family members are sick, and they don't have child care, and they're not sleeping well. They may be drinking too much. and just the overall emotional exhaustion of just going back to work and doing it every day, and then going home where you're working with your children because they're, the schools are closed, and trying to figure out how to take care of your parents. It just became overwhelming. So what can we do? I mean, this is what we saw, and I'm sure this is similar to what we saw around the country. What can we do as leaders? What can we do in the behavioral health field to support our members here? You can go on to the next slide. And this didn't change. So much did change in the COVID. So many things that I didn't expect happened. But as far as a leader and a leader's responsibility in a major crisis, I think it's always the same. It's always the same. And it was the same here. So as chiefs around the country, what can you do? I mean, you are busy. You have the weight of the world on your shoulders. But what can you do? And of course, there's nothing more stressful than a department that is not competent and they don't have a flexible plan. So that's number one. I mean, you have to have competent leadership, and that's not what we're talking about here. But that's the most important piece of it, and a flexible plan like we had at FDNY. And like I said before, communicate current information. Let your members know what on earth is going on, and it is so important that they know, exactly what's happening, and so they can be calmed by that information. I've seen it at every crisis I've been to. Is if you communicate to your membership exactly what's going on, exactly as much as you know what to expect, it will be helpful. And be visible as a leader. Be out there. I know that you're busy. I know you have things to do, but you don't want to be at the mayor's office all the time or in a bubble somewhere. Let them see you. Let them know that you're out there with them. That's so important that they see you. Also, it works. It works with school kids. It works with firefighters. It really works with anyone. Give them accolades. Tell them how proud you are of them. And one of the things that we heard after 9/11 is that no one said thank you. And so anytime I'm at a disaster, I often, and I have the opportunity to be with the chief, I would say, Chief, if you can, yourself or one of your subordinates, get to the stations, get to the firehouses, and just say thank you. Say how proud you are to be, to be a member of this department. If you as leaders can do these things, half of the anxiety, half the mental health issues will not occur. They won't, because they know that leadership has their back. Now, will you always have the funding that you need, the equipment that you need? Will you be overwhelmed sometimes with response? Absolutely. But if they know that you're there with them, you will, like I said, half of the anxiety will be reduced. You can go to the next slide. So, what did we do at our peak at FDNY? And I think, this would not be only for FDNY. It would be helpful around the country. What we did see was we have a 24-hour, 7-day-a-week hotline, mental health hotline, that is always answered by a licensed mental health counselor that's also uniformed. And we saw about a 30% increase in calls to that hotline. So there was, people knew the number. It's out there. It's all over the stations and firehouses, and people called because they needed support. They were isolated. They needed support. So having a 24/7 hotline was very helpful to us. Peer support at FDNY is really the backbone of our behavioral health program. We made a decision early in the crisis that we would have virtual peer support, that our peers would not go to the stations. But we had peers call the stations every day. Every firehouse and every EMS station was called every day by one of our peers and with a check-in. And the check-in could go for 3 minutes or it can go for 30 minutes, depending who answered the phone. And we would get valuable information. We would reach out to members that were having a difficult time, either having a difficult time with their family to see what we could do to support them, or we would, or they were having just a plain difficult time, getting to work every day because of the stress. So we gathered a lot of valuable information to do outreach with our virtual peer support. We also, a lot of the rules around telehealth were relaxed. So we had sessions, counseling sessions through telehealth. And again, about a 20% increase in our telehealth sessions where people were getting treatment over the phone or over Zoom or WebEx. This is a great platform to treat our members, because our members are busy. They have spouses that are working, they have second jobs, and be able to get on a Zoom call and get professional treatment. Every firefighter in the country should have that ability. If I were king of the world, that's one of the things that I would look to see, that there's no firefighter in this country that can't have free telehealth sessions for what we do for our communities. That should be the least of what we get. So again, that I think was very helpful. The department relaxed bereavement leave rules, which was terrific, because we have a 4-day bereavement leave where if you have a loss of a member, a loss of a family member, and there's in many cases family members were not being buried for 2 weeks or even later. So we were relaxing bereavement leave rules, and people would work and then go on bereavement leave, and so that I think was helpful, so people didn't feel the stress of that. We also did a social media blitz where we were giving, Twitter information and information through social media about behavioral health issues, how to get help. In our intranet, department intranet, we're constantly giving information about behavioral health. We didn't want this crisis, this physical and health crisis, to turn into a mental health crisis. And I think we need to prepare all departments for that not to happen. So we understood that very much could have been the case, and we didn't want that to happen. We can go to the next slide. So what are we doing now? Like what's our plans? We've been really proactive here, and again, what you can learn from what we've done, the mistakes that we've made, and the things that have worked. And please, anyone can reach out to me if I haven't covered it here. But we're training 100 new peer members, active members, 50 on the EMS side and 50 on the fire side. And our plan is, we just trained our first 25. Our plan is to pull these members offline, something that we've never done, and just flood the firehouses and EMS stations with information and peer support. Our members, our 17,000 members have been under a tremendous strain with the COVID crisis and now with the civil unrest. And we want a face-to-face with every one of our members. So we're going to train these new peers. We're going to attach them to the peers that we have, the 100 peers that we have, and we are going to flood our firehouses and EMS stations. We're also developing a behavioral health education campaign. It's going to have a short video, flyers, posters, direct mailings. We want to give them information. We know that they've been busy. We know that they've made tremendous sacrifices, and we want to let them know how much they're cared about, and we're going to give them this information. One thing that happened at FDNY is on both the fire and EMS side, that the the probies on the fire side, and the graduating class on the EMS side, it was 185 on the EMS side and almost 300 on the fire side. They were released early from education and Proby and EMS school and sent right into the field, into this crisis. And, they saw more death in their careers that probably many haven't in a full career. So we're bringing those new recruits, those new people back to the training academy. And we're going to have a behavioral health day. And we're going to support them. We're going to give them information. We're going to give them small groups where they can talk among their peers, because we know some of our newbies are uncomfortable talking among the senior members of the department. So we're going to give them their own space, and we're not only going to say thank you for what they've done, but we're going to give them as much information as we can. And we're also, this kind of, some things happen, when terrible things happen, some good things come of it. The department has made a decision that they're going to give behavioral health training to all the officers. And we do it now, but we're going to expand that. Because at every officer, lieutenant, captain, chief officer, there are many psychologists as well. So we're going to give them information so they can more support their members. And in closing, we're going to prepare for the fall and winter. And I know that Dr. Jim had said it right before. We're not going to be caught short. A lot of things we did not expect, and we had to kind of learn on the fly. But that's not going to happen this time. We have this information. We've been through it before, and it may be terrible. The corona crisis may be terrible in the fall and the winter. I mean, I don't know, but we're going to be prepared for it. So I'm sure on the operations side, but on the behavioral health side, some of the things that we did not expect, now we can't say that anymore. We have to expect it, and we have to support our members. Support our members that are giving everything for our communities. Our role is to keep them working and make sure that they're healthy and safe. That's all I have, Chief. It's been an absolute pleasure to be on here with the IAFC, and thank you, Chief Ludwig.
Frank, I can't say enough about the information you provided. It was truly outstanding. I learned so much. There's no words to describe it. And I can't speak highly enough or say enough accolades about peer counseling and peer support teams. You might know one of my lieutenants, Josh Jessup, and all the work that he does, and all the members of my support teams here. I've had to activate the team a couple times, and they truly are remarkable with what they do. So thank you for being here and sharing all this information. With that said, I want to thank all our panelists today, including our guest speaker, Captain Frank Leto from FDNY. It's no doubt they all provided terrific and outstanding information. I also want to thank Chief John Sinclair and Chief Pegram, who are chairing our different task forces for me. Finally, I want to thank our interim CEO, Rob Brown, and all the members of the IFC staff who are working many long hours and weekends during this coronavirus pandemic, and now as we see civil unrest. For those of you who are listening today, if you have any questions, please email them to COVID19TF@iafc.org. That's Dave Becker, and he'll be able to get your emails there. Thank you to Dave for all you do, too. Again, that's COVID19TF@iafc.org. As a reminder, we will be back next Monday at 4 p.m. Eastern Standard Time, when we will discuss the recent released document that was prepared and published by our IAFC's Terrorism and Homeland Security Committee on civil unrest challenges and their recommendations to the fire service during the coronavirus pandemic. In order to register for our webinar next Monday at 4 p.m. Eastern Standard Time, please go to iafc.org to register. As I always close, I'd like to say I'm honored to serve in this noble profession with so many outstanding people who make a difference in their communities every day. Please join us again on our webinar next week as we provide the latest updates and vital information. In the meantime, everyone, please stay safe. God bless you, and may God bless the United States of America.